Welcome back to 535. This is Paul Kane of Notice. I am joined by second-term Republican from the Hudson Valley, Mike Lawler. Welcome.
Thanks for having me.
All right. Wait, you are the Hudson Valley?
Oh, yeah.
All right, okay.
I'm the lower Hudson Valley, though.
Lower
so I have
Hudson, yeah.
Northern Westchester, Rockland County, Putnam County,
Okay.
and 3 towns in Dutchess County.
Yeah, all right.
Home of the Clintons.
Yeah, Pat Ryan was just here. And
Yeah, he's the immediate district north of me.
Yeah, that's what I thought. Would he consider you Hudson Valley, or would he
Oh,
think...
yeah. No.
Okay.
We're all, myself, Pat, and Josh Riley, portions of Josh Riley's district are the Hudson Valley. Latimer is lower Westchester and the Bronx, but Latimer is also part of the Hudson Valley.
Okay. We first want to talk about your bill, the Early Access to Screening Act.
Yeah.
The Breast Cancer Research Foundation estimates that 324,580 people will be diagnosed with breast cancer in the U.S. this year, with early detection as the most crucial tool. But this is one of those things that insurance companies, Medicare, others, do not like to pay for younger people. Explain your bill and the direct policy impact that it could have.
Well, I think we have seen an increase in younger people getting cancer, whether it is breast cancer, whether it is colon cancer, and those two cancers in particular obviously rely heavily on screening. And from my vantage point, I think as we evaluate, what are some of the causes, it's also important to actually reduce the age for screenings. And so the objective that I've put forward is to say, look, this is a real issue. We've seen younger women getting breast cancer. The 40 and above, 45 and above, in my opinion, is just too late. And so having the age reduced and requiring the insurance companies to cover these screenings is something that I think is important. It's something that I think we should be pushing on. I think when you look at healthcare overall, preventive measures and preventive action costs far less than actually having to treat these diseases, and especially when you're talking about people who are in their 30s or 40s, long-term treatment is extensive. So the more that can be done preventive, I think, is better.
Especially if you're coming from a family with
a history of it. And obviously breast cancer is one of those documented cancers where family genetic history does seem to play a significant role.
Okay. What is the pushback, though? There's always some sort of worries about cost. How expensive a program is this? Whether it's on the insurers,
right,
and they're going to say, well, we're going to, force this onto our customers, versus, people are already saying, well, the Medicare trust fund and Medicaid funds are running dry. What is the cost? I realize that there's going to be a long-term benefit,
right,
is what you're expecting, but
yeah, I think when you look at the exact cost, it is TBD, because part of it is who's going to go through that process and take the actual screening. But the pushback that I often get is that, well, it's the cases are not as prevalent, in 20-year-olds as people may think, and it's really not necessary, because if somebody does get a lump, or that they will go seek treatment. But to me, I just find that argument unconvincing, and I think when you're looking at the overall long-term trajectory here, preventative measures, pre-cancer screenings are way more helpful. And I think as you start to look at AI, for instance, and how AI is going to play a pivotal role in addressing things like cancer. The more data, the more information that is available, I think from a medical research standpoint, will also help us be able to make determinations. So some of the testing earlier and screenings earlier, I think, will have a profound impact when you layer that in with AI to actually start evaluating the overall data landscape with respect to things like breast cancer.
Also, if you're not testing younger people,
it's harder to make that determination.
Yeah, obviously there are going to be fewer cases if you're not testing them at all. How are you doing in terms of working through any sort of bipartisan sponsors yet on this? They're on the other side of the aisle. You know, this has been an issue near and dear to Debbie Wasserman Schultz. The women's congressional softball game grew out of that as an event to try and raise money that people like her and Shelley Moore Capito have been doing for a long time. Are Democrats willing to come on board for this, and where would you try to get this bill? I don't get too in the weeds in the process here, but you need a vehicle sometimes for narrow legislation.
That's the challenge. There's so many issues to legislate and so many bills that get introduced, and obviously only so much time to actually move bills on the floor, and so oftentimes you do need a much bigger vehicle to get key pieces of legislation like this through. Debbie and I have had pretty extensive conversations around this issue. I know this is an issue that's been near and dear to her heart. She has pushed to lower the age, for years. This is an issue, though, that I think in navigating, the question is, what is the right age to get not only the insurance companies but the cancer societies and get bipartisan consensus. And so, I feel very strongly about this, despite some of the pushback that I've gotten, because I think a lot of people think that we've brought the age, down too far. But my view is you gotta advocate, and if we can find the compromise forward, great. But I think this is an issue certainly that I've talked to Debbie extensively about, and part of it's just finding what's the right path forward on it.
Some Democrats might cynically, on background, just say, well, Republicans, they let the ACA Affordable Care Act's tax premium support expire, and now they're just trying to get good on health care issues. You've been one of the Republicans that was pushing for that to get extended. Is there any hope? Is there anything new on that front? Or is that maybe a lame duck issue?
Look, healthcare is obviously one of the most complex issues that we deal with as a country. We saw the complexity of the Affordable Care Act when it was being negotiated, and there were some good things in there. I also think there were some real problems with it. And the question to me is less about the politics and more about how do we actually fix the healthcare system from an affordability standpoint, from an access standpoint, from a quality of care standpoint, and from a workforce standpoint. And so I've been fighting on these issues since coming to Congress. Like this isn't something I just stumbled upon. I worked on this issue last Congress. I've worked on access to IVF. That's a big issue that I care about extensively. The ACA Enhanced Premium Tax Credit, after the government shutdown finally ended, a bunch of us sat down, as I said I would, in a bipartisan way, about 30 of us, and really tried to negotiate a fair compromise, which was to extend the enhanced premium tax credit. And remember, that was put in place during COVID as a vehicle to help folks during that pandemic. The premium tax credit is still in effect. So what we're talking about really is whether or not the federal government is paying 88% of the premium or 78% of the premium. Even still, the problem in large measure is that premiums continue to go up astronomically. And so the question is, how do you tackle the cost of health care? And I think there are a number of things that need to be done, including insurance company reforms. Why is it that an insurance company, for instance, United Healthcare, owns one of the largest providers, Optum Health? or Aetna owning CVS Caremark. Like, why are they owning PBMs? The monopoly that has been built over these 15 years under the Affordable Care Act did not create the economies of scale that were promised. And so cost has risen. The premiums have gone up between 125 to 150% over 15 years, while insurance company profits have gone up over 2,000%. One of the things that Republicans pushed was the associated health plans and allowing small businesses to pool resources together. Every Democrat voted against that at the end of the year last year when we put that on the floor. That would have reduced health insurance premiums by 11% across the country because businesses would have been able to pool resources together and buy cheaper plans for their employees. So there are a lot of different things that I think we need to be looking at within healthcare. The ACA Enhanced Premium Tax Credit was one of those things that I was willing to support. I discharged the bill out of the House. We voted for it. Unfortunately, it died in the Senate. I wish we could get bipartisan cooperation, but each side is going to have to recognize we got to actually work towards solution, not the political dynamic of healthcare, but an actual solution on cost, access, workforce, prescription drugs. The president is right to go after most favored nation. How do we do things that actually address the long-term healthcare costs?
I think you're able to talk about something you're working on with Josh Gottheimer on AI and some fears about what could happen in elections with people relying on AI searches for somebody like yourself in a competitive district.
Well, I think,
Give a quick summary of that.
Yeah, and Josh and I have worked closely together on a myriad of issues, and this is just the latest one. We're both on financial services. He's on the Intelligence Committee. I'm on Foreign Affairs. We both are very much in favor of America being a leader in the world on AI, on digital assets, on quantum computing. We want that to proceed, but there needs to be a regulatory structure out of Washington, and that is something we're championing. But one of the concerns that we both share is how AI could be utilized in a way to undermine election integrity. How are the AI companies guarding against how AI can be used to manipulate information flow in our elections, information about candidates? Where are they getting the information from? Do you have foreign bad actors trying to influence the models? These are things that I think are legitimate questions that the AI companies need to come to the table and talk to Congress about how they're safeguarding against.
I mean, you're not involved in the Northern Kentucky race, but AI is, people, all sides in that Thomas Massey primary are just using AI in their advertising.
Oh, it's crazy what is happening and how AI is being utilized, not just on social media by folks across the political spectrum, but by the campaigns themselves and by the super PAC groups. And so, this is something that I think we have to safeguard against and recognize, like, there are limitations to how AI should be used in the course of our electoral campaigns.
All right, this is we call it the 535 1
With
minute.
the intention of disrupting the normal business.
I ask unanimous consent. I ask unanimous consent.
The senator from Nebraska is recognized.
The gentlelady is recognized.
The gentleman is recognized for 1 minute.
Real quick, what is the best part of being in Congress?
Actually being able to get things done. Anytime you can pass legislation in support of your constituents, it's a big achievement. I was proud of what I was able to do in lifting the cap on salt to really provide tax relief for my constituents.
What's the most difficult part?
7-day-a-week job and a lot of time spent away from your family.
If you could fix one thing, what would that one thing be?
Ending gerrymandering. That's the biggest driver of why it's hard to get bipartisan compromise. There's only 19 seats that are actually competitive. Mine's one of them out of 435.
Best food in your district?
That's a good question. You know what? I'm Italian, Irish, from New York. I love Torriello's pizza.
All right, best committee assignment?
I love being the chair of the Middle East and North Africa Subcommittee on Foreign Affairs.
All right. The smartest member of Congress?
French Hill.
All right. Your favorite person on the other side of the aisle, and you're not allowed to say Josh Gottheimer.
If it's not Josh Gottheimer, I'll go with another short Jewish guy, Jared Moskowitz.
All right. What is your favorite phrase uttered just here in the Capitol complex that you hear nowhere else?
Oh, God. Marjorie Taylor Greene is a moron.
Your buddy Gottheimer had a very colorful one when we asked him that involved language that cannot be said. Well, cannot be said on official networks. Anyway, thank you very much for coming. We're going to take a break right now. 5:35. We'll be right back.